Alright, so here we have the first question of the 2024 National SSM exam that took place this year in Italy. As usual, the order of the answers has been shuffled. If you'd like, pause the video and try to answer it yourself. Otherwise, I'll explain it first, and then we can answer it together. The Bentall procedure involves A. Repair of the aortic valve and replacement of the aortic root without reimplanting the coronary ostia. B. Replacement of the aortic valve and aortic root with reimplantation of both coronary ostia. C. Repair of the aortic valve and replacement of the aortic root, reimplanting only the left coronary ostium. D. Repair of the aortic valve and replacement of the aortic root, reimplanting only the right coronary ostium. E. Replacement of the aortic valve and aortic root without reimplanting the coronary ostia. Alright, take a minute to think about this. The Bentall procedure in itself is a complex surgical technique used to treat severe conditions of the aortic root, of course, such as aneurysms, aortic dissections, or diseases involving the aortic valve. It's one of the main surgeries for addressing these conditions, and it's named after the surgeon who developed it, Sir Hugh Bentall. We're looking at answer B as the correct answer because we're replacing the aortic valve and the aortic root with reimplantation of both coronary ostia, not right, not left, both. You see, the Bentall procedure is considered a gold standard for treating complex pathologies that concern the aortic root and the aortic valve. However, the choice of the procedure depends on the specific conditions of the patient and also preoperative assessments. Alright, so now we're going to have two sample questions, one easy and another one a bit more difficult. Let's start with the first one. Which of the following critical conditions is a primary indication for the Bentall procedure? A. Severe mitral insufficiency. You might want to stop the video because I'm going to explain them as I go. So A would not be correct because while this is a serious condition, mitral insufficiency does not require the Bentall procedure, which is more specific to the aortic root and the aortic valve. B. Aortic dissection involving the aortic root. Yeah, that sounds about right. C. Isolated aortic stenosis. That may require aortic valve replacement, but not the Bentall procedure in itself, unless the aortic root is also involved. D. Moderate tricuspid insufficiency. Well, this concerns the tricuspid valve, not the aortic root nor the aortic valve. So it is not an indication for the Bentall procedure. Lastly, E. Aneurysm of the aortic arch without involvement of the aortic root. Well, of course, this type of aneurysm may require surgery, but again, not the Bentall procedure, which is specific to the aortic root and the aortic valve. Therefore, the correct answer is B. Aortic dissection involving the aortic root. Because remember, the Bentall procedure is primarily indicated for conditions involving both the aortic valve and the aortic root. This includes aortic root aneurysms, often associated with genetic syndromes like Marfan syndrome or aortic dissections involving the aortic root. The goal of the procedure is just to replace the aortic valve and the aortic root, restoring normal anatomy and function, and thus preventing further complications like aortic rupture or severe valve insufficiency. Alright, lastly, I will be presenting to you a slightly more difficult question. A 42-year-old patient with history of Marfan syndrome undergoes surgery for a aortic root aneurysm. During the surgery, the surgeon decides to perform the Bentall procedure using a mechanical valve prosthesis. Which of the following intraoperative complications requires a specific modification of the standard Bentall procedure, and how should it be managed? So each answer has a two-part answer to it, right? If you want, stop the video now because I will be answering as I go, one by one. All right, answer A. Early thrombosis of the valve prosthesis, so that's the complication. And the management, immediate replacement of the prosthesis. So this is wrong because early thrombosis of the prosthesis would require aggressive management with anticoagulants or just prosthetic replacement, but it's not a typical intraoperative complication of the Bentall procedure itself. Answer B. Difficulty in reimplanting the left coronary ostium. Use of a patch to extend the coronary ostium. Again, this one is wrong because this could be managed with a patch to extend the ostium, but it does not require a radical modification of the technique itself. Answer C. Massive bleeding from the aortic root anastomosis. Conversion to the David technique to preserve the native valve. Alright, so this could be managed with hemostatic techniques without the need for conversion to a different technique, such as the David one, which would be used to preserve the native aortic valve. Answer D. Acute coronary insufficiency during reimplantation of the coronary ostia, repositioning of the ostia using a coronary bypass graft. Alright, so coronary insufficiency during reimplantation might require a bypass, but repositioning the ostia does not necessarily require a coronary artery bypass graft. Instead, proper osteo repositioning should be achieved. Lastly, answer E. Laceration of the valvular annulus during prosthesis insertion. Repair with prosthetic material and possible conversion of the Cabral technique. So yes, this is about right, because laceration of the valvular annulus is a serious complication during the Bentall procedure. This may require complex repair using prosthetic material to reconstruct the annulus itself. In severe cases, it may be necessary to convert the procedure to the Cabral technique, which involves using a conduit to connect the aortic prosthesis to the coronary ostia, bypassing the difficulties of direct reimplantation.